Union nurses with Rochester General say the hospital isn't meeting required minimum staffing standards.
And a group with the union rallying in front of the main hospital entrance this morning. Isabel Garcia joins us now in studio with more on that. Isabel.
Yes, good afternoon to both of you. The union was first formed back in 2022, this a year after a state law on hospital staffing requirements had passed. But in the more recently agreed upon contract with RUNAP, the union and the hospital, there is a provision with consequences for not fulfilling the minimum staffing requirements. Next steps, I'm told, arbitration. A group with the Rochester Union of Nurses and Allied Professionals, or RUNAP, gathering outside of Rochester General Hospital Tuesday morning to shine a light on what they claim are critical staffing levels. Now, according to the union, in the first quarter of 2025, there was not a single shift when there were enough registered nurses working in the hospital to meet the clinical staffing plan. There was a single night shift, we're told, January 20th, when there were enough scheduled RNs, but a normal amount of sick calls the hospital failed to plan for, the union claims, dropped it under the required staffing level. Now, the data, which comes from the hospital administration each quarter as part of the union contract, is showing 97% of the time there was inadequate staff.
The nurses gave them ample opportunity to resolve this internally. So now we're going to arbitration that's handled by the American Arbitration Association. The hospital will eventually have to file their position, so we'll finally get what they're thinking. As far as I can tell, they're still scrambling to put that together. In the meetings we've had with them on this issue, it's become clear that they're not even looking at these numbers on a hospital-wide basis themselves.
In the 2021 state law on hospital staffing safety, union organizer Will McMahon tells me there is no consequence for hospitals when they don't meet that certain threshold, something the union included as a provision in its contract in 2022. Now, that component states if the hospital is not meeting safety minimums at least 90% of the time, so if their understaffing exceeds 10% of all shifts hospital-wide, it triggers a fine paid by the hospital each quarter.
The nurses have, through fighting for these improvements, started to turn staffing around. However, administration is not cooperating. They're cutting travel contracts as fast as we're adding staff, so the big picture isn't getting as well as it should be. And then they're reneging on commitments to end unhealthy shift rotation practices where a nurse can be made to work a night shift and then a day shift and then the next week back to a night shift, which has been linked to a significant drop in life expectancy of healthcare workers.
In a response to the rally, Rochester Regional Health issued a statement which reads in part, quote, "We disagree with the union's recent claims regarding understaffing numbers. We have not been able to validate their calculations. Based upon our calculations, we believe that we have met the previously agreed upon staffing levels," end quote. Now, the fine, should this go through, would be $100,000 the hospital would need to pay out directly to the nurses that have been working under these unsafe conditions, as the union claims. We're told this is most severely impacting the emergency room department. Now, the union staffing report, as well as the full response from Rochester General, can be found over in this article at rochesterfirst.com. For now, reporting in the studio, Isabel Garcia, News 8.